Good afternoon and welcome to our third Facebook Live of the fall 2021 semester. I'm Allison Perry with UK Public Relations and Strategic Communications. For much of the pandemic, most children have not experienced the same levels of sickness and complications from COVID-19 compared to adults, but with the more contagious Delta variant and a return to in-person learning, children are now at a higher risk for the disease. So to help parents, educators, and school administrators navigate this unprecedented public health crisis, Dr. Scottie Day and Dr. Sean McTigue with UK Healthcare's Kentucky Children's Hospital are here today to answer questions about the risk of COVID-19 to children and how to keep them safe. So thank you all for joining us. And we're just going to jump right in with the first question. First, can you all just give us an idea of what you're seeing down at the Children's Hospital?
Yeah, so at the Children's Hospital, we have seen an influx of pediatric patients for all conditions, but also for COVID-19. When it comes to children that are being admitted specifically for COVID-19, those would tend to be the ones that are classified as either severe or critical COVID-19 infections, meaning that they're requiring oxygen, or for critical, requiring ventilatory support. Since July 30th, we have had 5 times as many admissions to Kentucky Children's Hospital for severe and critical COVID-19 than we had for the entirety of the pandemic prior to that point.
We're also seeing the multi-inflammatory syndrome in children. That was kind of what was dominating the first part, and we suspect that as weeks go by, given the timing, that we will see more and more of that. We've had a couple now, but we obviously the post-COVID syndrome that we talk about, the MIS-C, was what we saw in the beginning. That was a majority of what we saw because most kids weren't getting that with acute COVID. Now kids are getting sick with acute COVID. We're also seeing a high infectivity. So if we follow the rest of the country, we would suspect within weeks of the acute surge, we're going to see MIS-C.
And as far as the demographics that we've been seeing, for those kids that are being admitted with severe or critical acute COVID, the vast majority of them have been 12 years of age or older. And so far, we've not had a single immunized child admitted to KCH for severe or critical COVID.
So in the beginning of the pandemic, we were kind of told that kids weren't really at risk. So what's changed since then?
I think it's the infectivity of the Delta variant. So earlier in the pandemic, we saw really 2 things with regards to children. Number one, children who were infected were very unlikely to become seriously ill. Most were either asymptomatic or mildly symptomatic, things like cold-type symptoms or mild flu-like symptoms. We also, however, weren't seeing very many children being infected at all in comparison to the numbers of adults that were being infected. And there's some complicated reasons about what makes children different, different receptors that are there in different concentrations that were likely responsible for that. What's changed is that the Delta variant is such a much more highly infectious variant of the virus that we're just seeing more people in general becoming infected, and that extends to children. And as you start infecting more children, even if you have the exact same percentage, a very small percentage, becoming seriously ill, more infections are going to equal more children being seriously ill.
So you mentioned, the age 12 and over. So let's talk a little bit more about that. The age groups that are at risk, and what about underlying health conditions?
So there are many things that are on the list of conditions that would make you at a higher risk of becoming seriously ill with COVID. And they include some of the things that you might think about, like children who are immunocompromised, children with severe heart conditions. But what we have seen is that the number one predictor of severe illness in children due to COVID has been weight. Obesity has by far and away been the risk factor that we have seen in the majority of the children that we've had admitted to Kentucky Children's Hospital. So it's those children who are obese or morbidly obese who are really getting into trouble.
Would it be safer to return to virtual learning until a vaccine is available to children under 12?
I think when we weigh the risk and benefits, we know during the pandemic when virtual learning, it wasn't possible for many areas of the country, right? It wasn't possible for multiple reasons. We also know the social isolation, some of the concerns, including, we saw 11% increase in suicides in children, which is just absolutely, it gives me chills to even think about it. And there's multiple reasons for that. And it's not just because of the isolation, it's because families are being torn apart by COVID. You know, it's every minute someone dies in the United States of COVID. That means a grandparent, a parent, some primary caregiver. And if you think about it, it just tears families apart. And so there's multiple reasons for this. And I think schools provide an environment for kids to be able to learn and educate. But I think using mitigation strategies to keep those kids safe. That's really what this is about, from vaccination and those other mitigation strategies that we've talked about over and over again. Because if kids go back to school and then they're out for a prolonged period of time for isolation or whatever related, then, you know, so we want things to be safe. We want kids in school. We want them learning. We want them to have those social networks.
Yeah, and along with that, I think it's important to point out that by and large, the children who have been becoming seriously ill with COVID have been 12 years of age and older. These are a group of children for whom vaccine is already readily available for all of them. And amongst that group, you know, the data that I have as of today from, you know, the Kentucky Department of Public Health, 47% of our children aged 12 to 17 are immunized. That's less than 50%. So even if we were to say that we're going to keep children out of school until they all have the ability to be immunized, you're still, at what point are all of them going to be immunized? Or at any point are all of them going to be immunized? So, you know, like Dr. Day said, you know, the AAP has come out very strongly in favor of kids being in school. You know, the educational consequences were quite severe of having a year or more, you know, outside of the traditional classroom setting. So, you know, I think we have a very good handle on which children are at the highest risk and how we can protect them. And if we could get all of those children who are already eligible for vaccine immunized and all of those adults who are already eligible for vaccine immunized, then we would see far fewer infections, and the likelihood that we'd be seeing children having severe complications of COVID because they're in school would be very, very low.
And to your point about mitigation strategies, we get a lot of questions about masks for kids. So can you talk about why it's important to mask kids age 2 and older at activities where you're around a lot of people?
Okay, I guess I can start with that one. So, you know, the first is to talk about, you know, what do we know about masks? And I will admit that, you know, the data is not as robust. We don't have, it's difficult to do a complete trial to show exactly what percentage decrease in your risk of COVID do you have if you wear or don't wear a mask. What we do know, however, is that there absolutely is some benefit to the person who's wearing the mask, okay? I see a lot of people talking about, you know, it's like trying to keep mosquitoes out of your yard with a chain link fence. You know, yeah, virus particles are very small. However, they're usually not just floating around on their own. They're in respiratory droplets, little droplets of water that are coming out of your airway that can and do get trapped by masks. All you have to do is watch someone sneeze or cough and see those little droplets. You know, Mythbusters, you know, did an episode exactly on that. The other thing is what we know that masks have a very good effect on is protecting the people around the person who's wearing the mask. So you can do a little experiment yourself. Just light a birthday candle, hold it out in front of you, and see how easy it is to blow it out when you're not wearing a mask. You can even talk, and you can blow it out just by talking. Now put on a mask, try to blow out that same candle, and it's not going to happen. And it's because, yeah, even though some air is certainly getting through, all of the air is getting through, but it's not forcefully expelling straight out, where it's going to be more likely to expel your respiratory aerosol particles and infect people. It's more likely to be pooling around yourself and falling. So there absolutely is some benefit to wearing one.
We've seen some parents concerned that wearing a mask will cause their child to have developmental displays. Any comment on that?
So I think the easiest part of that to address is I've heard a lot of people say that by wearing a mask they're going to be deprived of oxygen, and that their oxygen levels are going to drop and their carbon dioxide levels are going to rise. And that's just absolutely untrue. So you know, masks like this are nothing new. It's just new to asking the majority of people to wear them in a social setting. Surgeons have been wearing masks, you know, since surgery has been being done in a safe manner. Surgeons will routinely wear a mask for the entirety of a 14-hour liver transplant operation, and they're not dropping and collapsing due to low oxygen or high carbon dioxide. You know, gases exchanged through a mask easily. It's just not going to cause any of that. There was actually a great viral video early on in the pandemic where an ER nurse did a little experiment to show exactly that. He hooked himself up to a pulse oximeter, a little device that measures the oxygen level in your blood. He put on a mask much like this one and just continued to show the monitor no change in his oxygen level. And he just continued to put on mask after mask exactly like this one until his ears could no longer support the loops and they were popping off. And the number just did not change. So it's not going to harm you in any way, shape, or form to wear a mask.
So with kids coming back to school, should they continue the CDC health screening with students every day, and or should they get regular COVID testing?
Yeah, I think health screening is good. We talk a lot about being responsible as adults and being responsible as children. So sending your child that's potentially sick to school, I think the ramifications of not doing that screening puts a lot of people at risk. And I think we've seen story after story, and I'm hoping it's not a story that's going to get numb, because to me, when I hear 20 people die in Kentucky, 40 people die in Kentucky, 60 people die in Kentucky, it's heart-wrenching, right? And I think to know that the exposure that could exist by putting your teachers at risk or putting the staff at risk. And we've seen this. We've seen this not just here in Kentucky, we've seen it throughout the United States. So to me, it's about being responsible as a human being to protect those around you.
Yeah, I echo all of that, because it's important to realize that you really shouldn't be going to school if you're sick, whether it's COVID or not. You don't want to be giving somebody the flu. You don't want to be giving somebody anything else. We want to keep people healthy right now, and part of that is just being responsible and not going if you're ill.
I'm kind of tying on to that. So why do you think it's important for child care staff and school staff to be vaccinated, not just against COVID-19, but also the flu?
I think the easiest answer for that is because it is by far and away the best tool that we have in our toolbox to combat this pandemic. The way to keep yourself safe is to be immunized. So for everyone's own individual health, they should be immunized against COVID. And then because you are dealing with a group of people where some of those are going to be young children who cannot yet be immunized, your best way to protect them is by you not potentially being the person that brings COVID into that environment. Best way to do that is by being immunized. The best way to protect yourself from being in contact with a group of kids who are not immunized is to protect yourself with that vaccine. And then as far as flu has been killing people for far longer than COVID. And even the people that don't get killed by flu, they get ill. Some of them get seriously ill. Some of them wind up in the hospital. And at a time when we're seeing unprecedented volumes coming through hospitals, it doesn't just take an influx of COVID to overwhelm the system, but if you've got the COVID numbers that we have right now, and then if you were to add on a big influx of influenza, you might not be able to find a room. You might not be able to, and even if you can find a room, you might not be able to find a doctor, a nurse, a respiratory therapist to staff that and to care for you. So the best tool that we have for these things is immunization, and everybody should be immunized against COVID and against the flu.
And I think we talk about volumes and capacity and staffing, it's also not just the ones that are getting sick with COVID, it's the patients that can't get the other therapies. And we hear about it in Texas yesterday. Children's hospitals have shut down elective procedures. Now, we've not had to do that here because we know some of these, they're kind of elective, but in many of them, they need to happen. And I think it's really important for people to realize what that's about.
When do you think we'll see an approved COVID vaccine for children under the age of 12?
Should be very soon. So this week, Pfizer officially went to the FDA with their data and asked for authorization for their vaccine for children aged 5 through 11. This should be approved soon. I cannot say exactly when that's going to happen because that's a decision that's up to the FDA. But the data's there. It is a safe and effective vaccine. They've got a good dosing strategy for the younger children. So my hope is that before the end of the fall, we'll see that authorized and available.
There's been a lot of talk about boosters in the adult population this week. Maybe a premature question, but do you anticipate that children might need a COVID booster once the vaccine's approved?
So the answer is you don't know for sure. If you look at what has been, what has been approved by the FDA thus far, they've approved boosters for people that are over 65, for people who have high-risk conditions that would make them less likely to fully respond to a vaccine. So, for example, people who are immunocompromised. And then the other group that they added to that was people who are at very high risk of exposure due to their occupation, like, for example, frontline healthcare workers. What they did not recommend was routine boosters for all healthy adults aged 16 through 65. So as of right now, based on what we see, no, with the current recommendations. But science is a living, it's a living thing. It changes over time, not because people were being untruthful, or it's because you get more data, you acquire more knowledge, and you learn more. If we start to see that over a year's time that immunity is waning, then there may be a recommendation for boosters. If we continue to see what we're seeing now, which is that for the vast majority of people, the vaccine is still very, very effective, then the answer may be no. As it is right now, every day when we look at our numbers of who's in the hospital at UK with COVID, it's approximately 90% of the people that are in the hospital are unimmunized. They make up the minority of the population. So those people who are immunized are still protected.
And I think that that's a dynamic situation that could change. I think if you look back even a year ago, the Delta variant was just a little, and you hear about these little variants, so you never know what that may change. And we know that in the evolution of other illnesses across, the last century, that there's evolution that may change those recommendations. So as he says, it's a living thing that changes, monthly.
And we've touched on this a little bit already, but do you all feel it's safe to return to school as long as risk mitigation policies and procedures are in place?
I think the AAP has come out very strongly in favor of that, and that's a decision that's made, based on the best science that we have. And like Dr. Day said, is it going to be a zero-risk situation for acquiring COVID in a school? No. It's also not a zero-risk situation that you're not going to get the flu in school or anything else. Whenever you have humans gather together, you can see infections transmit. But we have absolutely seen the negative effects of having children out of school. Like Dr. Day spoke about, the increase in suicides, the number of admissions that we've had to our hospital for things like eating disorders, and other mental health issues that have absolutely gone up and gotten worse during the pandemic, and that really seemed to be at their worst when kids were home and isolated and outside of that environment.
Yeah.
So.
And what about the risk for kids who play team sports?
So, there's a risk there as well. However, the same strategy that can protect you, and that is the best tool that we have available, which is immunization, is absolutely what's going to make that safe as well. And we've got a great case study in that. So, if we look at our professional sports leagues, look at the way things were going with professional sports prior to immunization, where games were being canceled, postponed, all the time because we were seeing outbreaks, amongst the players, the staff. You're not seeing that this year, and that's because the vast majority of these players have gone out and gotten immunized because they know it's the best way to protect themselves, their own health, and their availability for their team. So if we get our kids immunized, especially the ones that are playing team sports, that's going to help keep them safe, and it's going to help keep them, help maintain their ability to have a normal life and to do these great things that kids do for their own health. It's great to go out and get exercise and participate in sports, and it's a great mental health thing, right? We had kids that were essentially locked in the house for a year. To get them out on a field and doing something constructive is a wonderful thing.
Yeah. No, I completely agree.
So how can parents kind of navigate and tell the difference between whether their child has COVID or maybe just a common cold or even just seasonal allergies?
I think the easiest of that to answer is whether it's the common cold or COVID, and the answer is you can't. You absolutely cannot. I mean, I'm a pediatric infectious disease doctor. You know, my training and everything I do is all about, you know, learning how to tell, you know, one infection from another in children. There is none of us can do that and look at a child and say that's a child who's going to test positive, that's a child who's going to test negative. So the answer is, if your child is sick, keep them home from school. Don't send them out, you know, to expose others. The best way to tell the difference between the two, get a COVID test. It's a simple swab or, you know, Q-tip from your nose, and you can get the answer one way or another, whether it's whether it's a cold or COVID. As far as allergies, you know, that's a little bit a little bit more tricky. If it's the exact same symptoms that you have every day of your life throughout the entire summer, well, it's probably your allergies. But if all of a sudden things are different and worse, well, you probably caught a cold on top of that. And whether or not that cold is, you know, rhinovirus or some other more routine virus or COVID, the only way to know that is to get a test.
And other is to rely on your primary care doc, your pediatrician. You know, the pediatricians have been just fighting so hard for the children of the state, and I'll say that across the state. That's kind of the best person to really help you mitigate that, because a lot of times if they've had allergies, you know, maybe they've been followed, is to call up your pediatrician's office and kind of discuss it with them, because a lot of times they are your doc who's walked along this with you for years, and so I highly recommend that.
This is going to sound like the line at the end of a commercial, but yeah, you know, if you have questions, call your healthcare provider. I mean, you know, your PCP, you know, that's your medical home, and if you have a question, absolutely, your first best answer is always just to call your PCP.
Yep.
So one of the questions we got was, you know, say that your child runs a fever, they're tested, it's not COVID. How long should a child stay home after they've run and broken a fever?
There's no great answer for that, because there's, you know, different illnesses have different periods of time where you're contagious. For most things, we recommend at least 24 hours after fever has resolved. Is a pretty good indicator that might be a time when it's safe to go back. But you also want to look at the other things. If your child had a fever, a fever, vomiting, and diarrhea, and they're still having diarrhea, well, they shouldn't go back to school, because that means that they're likely still contagious with whatever that was. If they tested negative for COVID, it's probably not COVID, but it's still something else, and we don't want to spread any of that. So really, when your child is fever-free for at least 24 hours and, you know, feels better from what they had, those are generally good indications. But like Dr. Day said for the last one, great answer to that is call your pediatrician or your primary care provider, whether that's a pediatrician, a nurse practitioner, a family doc. They've got great answers.
Should vaccinated parents or school staff get tested for COVID after they've been traveling?
Yeah, the regular testing of COVID is not necessarily recommended unless it's before a procedure. Like if you were coming in, and this is where a majority of our COVID was picked up in the first round, was that these kids were coming in needing their tonsils removed or their dental procedure, and they were being picked up asymptomatic. But just regular testing without symptoms is not recommended. Yeah. Now, there are specific travel guidelines, and so we would refer you to the website to make sure you guide that, especially if you're outside of the United States. But in general, routine testing just to be tested for COVID is not recommended in children.
Exactly. And to point out why we do asymptomatic testing for people that are coming in for procedures, the reason for that is because generally someone is going to be having a very, very close high-risk exposure to that patient. So for example, someone coming in for a routine tonsillectomy, you're going to have an anesthesiologist who's going to be intubating that patient, manipulating their airway, directly exposing themselves to their respiratory to their respiratory tract. And if you have a small amount of virus present, that's very unlikely to cause an infection in somebody who's across the room from you, say in school. That may be a higher risk for somebody who's going to be directly right down in your face, manipulating your airway. So there's reasons why we do that in a hospital setting that don't necessarily apply to a more routine public setting.
All right. Besides masking and just like good sanitation, are there things that schools and parents can do to cut down on the incidence of other infectious diseases like RSV or strep throat or bronchitis?
I think for parents, it's the same as kind of like, don't send your kid to school sick. And it sounds simple, but really be cautious of others around you. And I would say that's always been the case for a lot of these things. Obviously, you want to wash hands and all these different mitigations, but it kind of falls in line with everything else. Like, you know, try not to send your kids to school if they're sick.
Yeah. And you know, to go along with that, I would say a negative COVID test is not just a passport back into school, because if you're ill and you have a negative COVID test, all it tells you is it's not COVID, but it's going to be something else that is transmissible, and the best way not to transmit that infection is not to go around people when you're sick.
Yeah.
And we've touched on this a little bit kind of throughout this chat, but you know, we're a year and a half into this, and can you all comment a little bit further on the impact that the pandemic's had on the mental health of children?
Yeah, it's, you know, I talk a little bit, and we're talking about mitigating COVID and talking about how do we keep it under control, how do we get people vaccinated, and that is the fire that's, who knows, you know, I can't predict how long it's going to be there, but at the same time, the other fire that's there that continues to kindle is mental health. And to say it just came out of the pandemic actually isn't even true, because we were having mental health issues before that, whether it be from neonatal abstinence. We know the number of children born in Kentucky to moms addicted to opioids has continued to rise, and actually the pandemic's made that worse. Kids being isolated for various reasons. We've seen an 8% increase in hospitalizations due to mental illness, you know, and part of it is we have to have a strategy of how to help kids cope with what has become a new normal. And I'm not just talking about the new normal of, you know, we're talking about vaccines, and we need vaccinated, but a new normal of people's interactions, right? You know, we know that there's just stress levels that are just unimaginable in caregivers, in healthcare workers, in everybody. And so helping children navigate that is so important, and also having discussions, right? Like having intention in the discussions that you have with children. I think the other thing that's also concerning is we always, you know, teenage is a very difficult year. A lot of that focus is 14 to 18. But what we've seen in Kentucky is it just goes lower. And so then we got 10 to 14-year-olds thinking about things that, you know, I get choked up thinking about suicide. I'm like, how did it end up this way? And so I think that is something that's not going away. And it's not something, you know, that we have to be able to talk about the future of Kentucky. You know, our big mission is, how do we keep kids healthier, and how do we get Kentucky healthier? And a big part of that falls within mental illness. And so that's why we feel like it's important to have kids in school, but it's important to have mitigation strategies to keep them safe in school, right? We talk about all these different things we do in school to protect from different types of violence and different types of, you know, we talk about cars, wear seatbelts, we talk about all these different things. Now we're talking about, let's keep kids in school, let's mitigate the risk to the kids. This is such an important time. And it's an important time for me to reflect on us as you know, for a little bit we talked about a commercial, it's just loving one another, right? I mean, let's just take care of each other. That's what's important.
Yeah. And I will echo everything that Dr. Day just said, and add that the strain of being out of school, out of sports, away from their friends, didn't just create out of the blue a mental health issue, but it absolutely worsened mental health issues that were already there. And it's tragic to talk about, you know, children who committed suicide during this time that might not have. But there's also kids, you know, that are developing mental health issues that are a little bit more below the surface, that may be lifelong anxieties or depression that might not make it into a statistic like suicide, but that are going to be there. And I've absolutely seen the difference in kids this year versus last year at the same time, with being in school, having activities, being around their friends. It absolutely helps. And the best thing that we can do for them is to ensure that we can continue to provide that normal type of environment. And the best way to do that is to immunize yourself, immunize your loved ones, immunize your children, and to ensure that we can get through this pandemic, come through on the other side, and still have things like normal in-person school, sports teams, Boy Scouts, Girl Scouts, church groups, all these things that help provide a normal childhood, teenage experience. And the best way that we can continue to provide all of that is to keep ourselves and our kids healthy, and that's to be immunized.
All right, final question. Do you want to say anything that I haven't asked about, or any points that you'd like to reiterate just one more time?
I think this won't come as a shock, if anyone's listened to my comments so far, but a personal plea, if you are not immunized, I would strongly urge you to think about that decision. We've been given an amazing tool to help end a pandemic that has taken an absolutely horrible toll on our country and the world. And all you have to do is choose to use it. And that tool is immunization. So please get yourself immunized, get your kids immunized. I don't want to continue seeing the illness and death that we see coming through the hospital.
Yeah, I will echo those. I think it's been a stressful year for so many people, and I think initially the silver lining was that, well, children aren't being affected. But now children are being affected, and from being a part of a community as an ICU doctor, and listening to the stories of sitting near a parent or sitting near a loved one, and sometimes it's a child who says, they're there for something else. I lost my primary caregiver to COVID. That's a whole different aspect that I think we don't always see, in addition to children who have died of COVID, or children that have long-term consequences. And I would say there's no greater honor that we have, and I would speak for our doctors, than to be able to take care of the children, because ultimately we want to see them 20, 30 years later do great things, raise families, do all these things. We have the tools to do that. We have the ways to mitigate it and the ways to move on. And so when someone talks about statistics, because this is frequently a question we get, well, it's just a small percentage of the overall death rate. It's still a child that, I get heartbroken when I see a child die from anything and from something preventable. That's what really just hits home for all of us. And I know it hits home for all of our providers. And I think as we talk to people about it, we're providing facts with some emotions. And those emotions are driven by what we see every day. And we see it that in many cases it's a preventable illness. And so we encourage people, we like to be asked questions, actually, because then we get to give the answers. And some of the questions, we can't have a crystal ball to say, is there going to be more surges or anything? But I also think, when I think about what will history tell about this pandemic 20 years from now, we talk a lot about the Spanish flu, we talk about the polio, we talk about measles, we talk about H1N1. And then we look back and we look at the history books and we read about what we learned. I guess my question to everybody that we question is, what will the history books say about the COVID-19 pandemic? And what will the future of children be? We have a chance to make a difference, and we just want to encourage people to take that opportunity.
And I think that's a perfect way to wrap this up. So thank you all for joining us. We've been chatting with Dr. Scottie Day and Dr. Sean McTigue with Kentucky Children's Hospital. So thank you all for everything that you do for our children and to try to keep the Commonwealth safe. Thank you all for tuning in, sending us your questions, and we'll see you all next time.